Hi friends, Dr. Tejal Pandya. While you were waiting for today's Super Bowl halftime show, I wanted to answer a question that I know you have. And that is, how do you diagnose a hiatal hernia? So let's recap real quick what a hiatal hernia is. The hiatus is a naturally occurring hole in the diaphragm, which is the flat sheet of muscle that separates the chest from the abdomen. And the hole is there because the esophagus needs a way to pass down through the chest and connect into the stomach so that your food can get to the right place. So the problem is that when this space, the hiatus, when it becomes too enlarged, it's no longer giving that nice appropriate hug around the bottom of the esophagus that helps keep food and fluid down. The other problem is that when that space is enlarged, the stomach tries to migrate into the chest. It doesn't try, it actually does. And this is also an additional compounding problem to having the hiatal hernia. So when you hear people talk about how big their hernia is or the measurement of the hernia, most often they are talking about the vertical extent, meaning how high into the chest is the stomach extending. But we do have to know both the height and the width of that space. So that might make it easy to understand why endoscopy is the best test to evaluate a hiatal hernia. We need to be able to look with our own eyes at this dynamic structure that slides and moves when you swallow, when you breathe, because remember, the breathing muscle, the diaphragm, is the hiatus, right? So the endoscopy is the only test that allows us to look at it in real time and to take measurements, to stop and watch, blow some air, do things that can kind of provoke it into showing us the fullest extent of what the hernia is in your body. As you can imagine then, it is important to have an endoscopist who is going to take the time to do that, is going to be patient during your endoscopy and take time to get the best look and the best measurements. Now, sometimes I have people tell me my hiatal hernia was diagnosed on a barium swallow or a CT scan. And yes, you can see your hernia on those types of radiologic tests, on X-ray type tests. What this means is that during the time of the X-ray, your stomach was at least partially into the wrong area, right? Into the chest, pushing on the lungs, because that's what happens when the stomach goes in the chest. It pushes on the lungs. The lungs don't have enough space, but that's another topic we can talk about. But it means that that was captured on your X-ray. What it does not mean is that we understand the fullest extent of that hernia. Again, it's a dynamic area. There's movement constantly with every breath, every swallow. Sometimes it could be showing itself bigger or smaller, and you just got to have a little snapshot in time, like a photograph. Okay, not a video, but a photograph. Still, when you get that radiologic result, it is still important to get an endoscopy in order to understand the full character of your hernia. Now, if someone says, well, it was seen on my X-ray, but not on my endoscopy, that's where seeing someone that does endoscopy on people like you every day routinely or every week routinely is really important. And just because you don't see one on an X-ray does not mean that you can rule out a hiatal hernia before you have an endoscopy. I hope that helps, and I hope you enjoy the Super Bowl today.